Overseas, another record caseload in Australia with more than 147,000 new cases reported so far today. And the hardest hit is its most populous New South Wales state. 53 new deaths have been confirmed today. After successfully containing COVID-19 earlier in the pandemic, Australia has reported nearly 1 million cases over the last 2 weeks as people slowly get adjusted to living with the virus amid fewer restrictions. With more is Australia correspondent Jonathan Pearlman joining us from Sydney. John, Australia has seen daily highs for the past few days, another record today. What's the mood like in the country and how has the crisis affected day-to-day life?
Yes, so it's a big change for Australia, which, like Singapore, hadn't really experienced any of these phenomenally high case counts that we've seen all around the world. And then suddenly, case numbers have just spiraled, particularly in the states of New South Wales, Victoria and Queensland. So the mood has been one of surprise and confusion and some degree of chaos as Australians have had to quickly adapt, and the government has had to quickly adapt and change rules very quickly to try to adjust to this enormous outbreak. Life is continuing as normal. We've just come out of the Christmas New Year break, so things here are always a little bit quiet at this time of year, but things are a lot quieter than normal. People are avoiding shops. A lot of people are wearing masks even when they're not required to. Australians are still sort of waiting and seeing about what this outbreak will mean for them.
Right. John, the government has so far not announced any lockdowns to curb the spread. So what's the plan now to manage this wave of cases as the healthcare system comes under growing pressure?
It's a very good question because it's not altogether clear that there really is a plan. It's been difficult for people to get tests. The government's quickly moved away from PCR testing, which really wasn't able to cope, to rapid antigen at-home tests. For now, governments have been avoiding lockdowns and continued with the end of restrictions. But what they're hoping is that hospitalisations remain contained, that people, even despite the high vaccination rate, that younger Australians, now 5 to 11-year-olds, are able to vaccinate, so that younger Australians will vaccinate as quickly as possible. And that hospitalisations will remain low, ICU numbers, intensive care numbers will remain low. And so the easing of restrictions will continue and we won't have to return to lockdowns. That's the hope. But for now, the plan, if there is one, continues to change.
Let's talk about testing. You mentioned as well regarding PCR and rapid antigen tests. Australians are having trouble buying rapid antigen tests due to a lack of supply, and because of this as well, shops are boosting the price of the kits. But we understand that the government has bought $62 million worth of the test kits. Do you think it will help to solve the shortage problem?
Look, it's one of the big changes here is that for 2 years, authorities urged Australians, even if they had the tiniest scratchy throat, to go out to one of the testing centres. Suddenly, we're being told not to go to any of the testing centres, stay at home, get tested at home, and use an at-home test. The problem has been there hasn't been enough at-home tests to accommodate all Australians. Supermarkets have run out of them. Chemists have run out of them. So the government is now, quickly trying to import as many as possible. Supermarkets say they're on their way. It's going to take some time before there are enough tests reaching enough Australians that they're able to test at home as required. And the other difficulty is cost. These tests cost a lot. Some shops have been caught price gouging or lifting their prices unfairly because of the short supply. And for some people, particularly people on low wages, it's been very difficult to afford the tests they need to make sure that their families are healthy.
Jonathan, thank you for the updates. Australia correspondent Jonathan Pearlman in Sydney. Over in Melbourne, where crowds at the upcoming Australian Open will be capped at 50%. Face masks will also be mandatory and spectators must socially distance while indoors. All staff and players must be vaccinated, and while the vast majority are, world number one Novak Djokovic is not, which has sparked a global incident. He's been training at Melbourne Park since a federal court reinstated his visa on Monday.